for additional families and loved ones to be reunited. First, we will create a process to allow extended family members of Canadian citizens and permanent residents to enter the country while respecting quarantine requirements. Beginning on October 8, 2020, certain extended family members of Canadian citizens and permanent residents will be eligible to travel to and enter the country. Premièrement, j'annonce que nous allons créer un processus pour permettre aux membres de la famille élargie des citoyens canadiens et aux résidents permanents canadiens d'entrer au pays tout en respectant les exigences de quarantaine. Lorsque ces nouvelles mesures seront en place, cela signifie que les membres de la famille élargie des citoyens canadiens et les résidents permanents canadiens seront admissibles à se rendre au pays et à y entrer. These new measures maintain the integrity of Canada's borders and all health-related checks already in place. These measures will include people in an exclusive, long-term relationship and their dependent children, as well as non-dependent children, grandchildren, siblings, and grandparents. As I said, these measures will take effect on Thursday, October 8, 2020. While new measures to allow admissibility will be put into place, I want to emphasize that travelers should not make any travel plans until they have received all the necessary pre-arrival authorizations. En attendant, les voyageurs ne devraient pas faire des projets de voyage tant que ces renseignements détaillés ne sont pas disponibles. It's also important to note that extended family members will have a pathway to Canada as long as they stay in Canada for more than 15 days, meet all other admissibility requirements to enter the country, travel with a valid passport or documentation that shows that they fall under one of the permitted categories of travelers, and as long as they receive written authorization from the relevant authorities prior to travel. In addition, as the health and safety of Canadians remains our top priority, anyone wishing to enter Canada will be subject to all public health measures, including the mandatory 14-day quarantine period upon arrival in Canada. For those struggling with serious illnesses, the pandemic has proven to be especially difficult. To help ensure that they have the support that they need, we will also be introducing a process to allow foreign nationals to enter the country for compassionate reasons. Nous allons également introduire un nouveau processus pour permettre aux ressortissants étrangers d'entrer dans le pays pour les raisons de compassion. My colleague, Minister Haidu, will provide more details on this process in a few moments. Finally, let me address international students who contribute significantly to our economy, our universities, our colleges, our schools, and they enrich our communities across Canada. Effective October 20th, 2020, international students attending a designated learning institution that has been specifically approved by their provincial or territorial government as having a COVID-19 readiness plan will also be able to enter Canada. Les restrictions de voyage actuelles seront modifiées pour les étudiants étrangers au 20 octobre s'ils fréquentent un établissement d'enseignement désigné qui a été identifié par leur gouvernement provincial ou territorial comme ayant un plan de préparation COVID-19. We also want to underline that every international student traveler must abide by the 14-day mandatory quarantine period upon entry into Canada. The robust travel restrictions we've put into place to protect the health and safety of Canadians remains in effect. The pandemic is an ongoing threat, and we need to continue to be cautious and restrictive about who can enter into Canada. We recognize, however, that these restrictions should not keep loved ones apart. We know these are challenging times, and we know these challenges can be best met with the strength and the support of those we love by our side. Nous savons que ces temps sont difficiles Et nous savons que ces défis peuvent mieux s'affronter avec la force et le soutien de ceux que nous aimons à nos côtés. The plans announced today respond to the needs of Canadian families, people who have been separated from their loved ones by international borders. Anyone intending to travel to Canada will need to continue to follow quarantine requirements and public health guidelines to help control the spread of COVID-19. By putting these processes in place, along with the strengthened public health and safety measures, the government is supporting families, loved ones, and our economy in ways that will protect the health and safety of all Canadians. On a closing personal note, I just want to say to Sarah Campbell, I know you've waited a long time for today, and I'm very happy we could make this announcement today on Jacob's birthday. Thank you very much. Merci beaucoup. I think we will turn it over now to
Minister Haidu.
Minister Haidu.
Okay. Thank you very much. Bon après-midi. Pour faire face à la COVID-19, notre gouvernement a dû prendre des décisions qui ont bousculé vos vies. Vous avez fait des sacrifices, souvent différents, pour répondre à ces nouveaux virus. Je tiens à nouveau à vous dire merci. The increase in COVID-19 cases is due to community transmission, not travel. So as Dr. Tam said earlier today, we all need to double down on our efforts to stop the spread of the virus. And we all know how to do this. Wash our hands, stay physically apart, wear a mask, and say no more often than yes to social invitations. And if you're not feeling well, stay at home and reach out to local public health for advice. And of course, download the COVID Alert app and join the 3 million plus Canadians that have done so to date. As we continue to work through this very difficult time together as a country and indeed as a world, we often hear tragic stories from across the country. Stories of families who can't be together when they need each other the most. So today we're announcing a new process for foreign nationals to be able to enter Canada for compassionate reasons. And this will apply to specific and limited situations. For example, to say goodbye to someone at the end of their life, or to provide care for someone in Canada who requires medical support, or to attend a funeral or an end-of-life ceremony. It will also be possible for those entering or returning to Canada for compassionate reasons to ask for limited release from mandatory quarantine in very specific situations where respecting the 14-day mandatory quarantine period isn't possible. And these situations could include being with someone you love to say goodbye at the end of their lives, or attending a funeral or end-of-life ceremony. While we of course want to be compassionate, we also need to manage the risk of community spread, and we all have to continue to be vigilant. The decision to allow someone to end their quarantine early will be coordinated with the provincial or territorial government who have their own laws. And those foreign nationals who wish to enter Canada for compassionate reasons will have to apply and be approved in advance of arrival. And of course, all travelers will continue to undergo health screening before they can fly to Canada, and no one who has COVID-19 will be allowed to enter. Detailed information on the process will be available on October 8th at canada.ca. Thank you, everyone, for all of the hard work that you personally are making during this tremendously difficult time. We know that it's been a long haul, but we know we also have what it takes to get through this together. Thank you. Merci.
Minister Blair.
Bon après-midi and merci to Ministers Haidu and Mendicino. We know that throughout this global pandemic, many people have had to make personal sacrifices. Every Canadian and every Canadian family has been impacted by the pandemic and have made sacrifices. It has always been our intention to keep families together. And we have, throughout the pandemic, permitted entrance to immediate family members. But we know that not all families fit the same mold. And that's why today we are announcing measures to help more loved ones reunite on compassionate grounds. As my colleagues have noted, the full range of screening and security measures will remain in place and must remain in place for all travelers, as does the requirement to quarantine. These are measures that have been put in place to keep us safe, and we will maintain them. We are now half a year into this global pandemic, and Canada continues to take unprecedented action to limit the spread of COVID-19 in our country. A major part of our response has involved restricting non-essential and discretionary travel across our borders. Over the past 6 months, we have put in place emergency order requirements in accordance with the Quarantine Act. And we have done this while consulting with all levels of government and with our foreign counterparts. The government continues to enforce and to strengthen these measures. And to be clear, everyone entering Canada, no matter their country of origin or mode of travel or entry, they must isolate themselves for 14 days, whether or not they have symptoms of COVID-19. Modifications to these strong and necessary provisions are rarely approved and are reserved for those engaged in essential work. Foreign nationals displaying symptoms are not permitted to enter Canada, regardless of their reason for travel. And all travelers are required to provide their contact information and follow the 14-day quarantine or isolation requirement. And these mandatory quarantine measures have, in fact, been very effective. That's evident by the significant drop we've seen in COVID-19 cases which are related to international travel. For example, at the outset of the pandemic in early March, we saw cases related to international travel at nearly 22%. And as a direct result of the work and the restrictions that we have put in place, that has dropped to just 2%. And furthermore, to make sure that we are keeping Canadians safe, the government is dramatically scaling up the federal public health presence at our border. That presence will now cover 36 ports of entry that account for 90% of all traffic into Canada during normal operations. Every port of entry has a 24/7 access to quarantine officer support through the central notification system. And we have a total workforce of 190 public health workers who have already been deployed and are being deployed across the country. That's up from only 18 when the pandemic began. To improve information sharing and alerts, the Public Health Agency of Canada has introduced digital portals, including the ArriveCan app for travelers to share their critical information. That helps us share data with the provinces and territories quickly and securely to ensure effective action. The government is also strengthening compliance and enforcement efforts. The Canada Border Service Agency has put in place measures to help the Public Health Agency monitor and enforce the mandatory quarantine and isolation orders. About 100 screening officers make approximately 4,300 live calls and 3,500 automated calls each and every day. That's nearly a total of 1 million contacts since March, and we're working with our partners to increase that number every single day. If any individual cannot be reached on phone, or if there is a suspicion that someone is not complying with the quarantine requirements, local law enforcement follows up, and they have the full authority to issue fines and undertake enforcement as is necessary. As my colleagues have mentioned, we know that there has been significant impacts for some people as a result of the travel restrictions, and it's important that our rules demonstrate compassion and understanding. All decisions related to the border are made with health and safety and security of Canadians as our first and highest priority. I would like to take a moment, if I may, to thank the men and women who have been implementing these border restrictions and keeping Canadians safe. Our border service officers and our public health officials working in partnership and together remain vigilant. They're working around the clock to protect Canadians by identifying travelers who may pose a risk to our health and safety. I want, on behalf of all Canadians, to thank them for their vigilance and their hard work. And I look forward to continuing to work with our partners in making sure that the measures that we put in place at our borders are in accordance with the latest public health advice. Thank you very much for your understanding and your support.
We will now open the floor to questions. As a reminder, please limit yourself to one question and one follow-up, and please begin by identifying yourself and naming the media outlet that you represent. We're going to begin with 3 questions over the phone. Operator, please proceed with your first question.
Thank you. Please press star 1 at this time if you have a question. There will be a brief pause while participants register for questions. Thank you for your patience. S'il vous plaît, appuyez sur étoile 1 Maintenant, pour poser une question, il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Merci de patienter. Our first question is from Louis Blouin, Radio-Canada. Votre ligne est ouverte. Please go ahead.
Oui, bonjour, Monsieur Mendocino. Est-ce que c'est le bon moment d'avoir des assouplissements comme ça alors que le nombre de cas est en augmentation importante au pays?
Merci pour la question. Écoute, nous comprenons bien que le priorité qui sont les plus importantes pour notre gouvernement est la sécurité et la santé de tous les Canadiens. Ça, c'est la raison que nous avons pris le temps que nous avons besoin pour mettre en place un plan qui est là pour protéger la santé des Canadiens. On avait ajouté des ressources à la frontière internationale, comme vous avez écouté pendant la présentation de le ministre Blair et Haidu. Mais en même temps, on va démontrer de compassion où nous pouvons. Et ça, c'est le processus que nous avons introduit aujourd'hui.
Beaucoup de gens ont attendu longtemps avant de voir ces changements-là arriver. Qu'est-ce qui a fait que ça a été si long d'en arriver là?
On avait pris le temps qui est nécessaire pour mise en place un plan qui est responsable. Il y a une nécessité d'engager avec nos partenaires partout au Canada, avec les gouvernements provinciaux et territoriaux et avec tous les agences et les départements pour mettre en place qui est responsable, pour accomplir les bouts de cette plan qui est de protéger, premièrement, de protéger la santé des Canadiens, mais en même temps, d'exercice un peu de compassion pour les familles et les personnes.
Operator, next question.
Thank you. Our next question, la prochaine question, Lauren Gardner, Politico. Votre ligne est ouverte. Please go ahead.
Hi, thanks for taking my question. Could you talk a little bit more about what this process is going to look like exactly for those who would have to apply for admission, how quickly it might take, and how, like, is it going to be online? How is it going to work?
Well, as you heard throughout the presentation, we are introducing a number of processes to address families, to address compassionate cases, and international students. We have taken the time that is necessary to be sure that the additional public health and safety resources are in place at the border, and I will defer to Ministers Haidu and Blair to expand on that. But with regards to the definition for expanded families, this will include those who are in exclusive dating relationships for at least a period of 1 year, and where those couples have been in the physical presence of each other for some period of time. They will have to demonstrate that relationship by procuring a notarized declaration and then providing that declaration to the relevant authorities. And those authorizations have to be secured prior to travel. And I just want to take a moment to underline that component so that people are aware as to when they should start to make their plans to come to Canada only after they have reached out to the government. And in the case of families, it would be my department at IRCC where they would obtain that authorization. And then once arriving at the border, making sure that they've got their 14-day quarantine period very well laid out, because as we know, CBSA officers still retain the discretion to assess those plans prior to admitting entry. There are some other categories, as you heard during our presentation, that deal with compassionate cases, and perhaps I will turn it over to Minister Haidu to say a few words about that.
Well, thank you very much, Minister Mendocino. And I'll just say that it's a great question, and part of our deliberation is around making sure that there is a process that families can follow, and that it is actually a smooth process, and that it provides a certainty to CBSA, because of course they are processing a high volume of travelers, and they need a certain process so that they have the capacity to be able to make those assessments as quickly as possible. The model that we're using for compassionate reunification and also for international students rests on learnings that we've gained through the pandemic of how important it is to work with at the local public health level and the provincial public health authorities. And in fact, if in the case of compassionate care reunifications, we've actually managed to facilitate some of those compassionate reunifications in the case of an end of life, for example, or in the case of severe needs for care, using a partnership process with local public health. Because of course, local public health at the end of the day is at the ground zero of managing any COVID case, and I think that's the principle behind the way that we're working. In terms of international students, we rely heavily on our provincial and territorial partners to feel certain that the designated institutions have done a thorough job of making sure that they have a plan to appropriately support students who are coming to Canada to quarantine safely and with the supports they'll need from a medical and a psychosocial perspective. And we work very closely then with the schools to make sure that their plans will actually be able to be materialized in a way that gets at both the goal of protecting Canada from importation of COVID-19, but protecting the students themselves during what is actually quite an arduous process.
Lauren, follow-up?
Yeah, thanks. You laid out some clear groups of people today who are going to be able potentially to take advantage of these new exceptions. But since you said that travel represents, or importation of cases from traveling abroad represents a tiny fraction of cases in Canada now, are you actively considering any other groups of people who may be allowed to cross the border sometime in the near or medium term?
Maybe I can start and then turn it to Minister Blair. I think part of what's been a big success of Canada's approach is actually a rigorous quarantine process at the border. And the quarantine of 14 days has been guided by our public health experts who have guided our approach all along to the response to COVID-19. And in fact, as we know, that is the outset of when someone will develop symptoms or COVID-19 after exposure. And so the measures we're announcing today do not reflect a general trend towards alleviating measures in other capacities, and we continue to monitor the situation of COVID-19 around the world as we deliberate the next steps on border entry. But this announcement today is really to reflect the very difficult circumstances that Canadians find themselves in, and the very real need of international students to be able to continue their studies in a safe and appropriate way with partnerships of the provinces and territories. Minister Blair, did you want to add anything?
Yes, if I may. I think it's also important to look at in terms of, I think, the success and the numbers that I've presented today of what we've been able to achieve at the border in significantly reducing the transmission of this illness in ways related to international travel. That isn't an argument for reducing our efforts at the border, and rather, in fact, I think it's evidence of the efficacy of the work that we have done, the effectiveness of both the public health response in quarantine and the efforts of our border service officers to maintain safety for Canada. Now, in the lessons that we have learned in that hard work, we know that there are some extraordinary exceptions that we want to be able to consider, but we will always remain vigilant. I want to be able to assure Canadians, and I've spoken to border mayors across the country and our provincial counterparts, and Canadians right across the country who are quite concerned about the health circumstances they see in other jurisdictions, and they want to make sure that we're taking all of the steps necessary to keep them healthy and safe. And we're not going to compromise those efforts through these new measures announced today. And in fact, we announced them today because we are confident that we can manage these exemptions and exceptions based on the evidence and the learnings of the past 6 months. We're going to remain vigilant, and we're going to do the work necessary and to make sure we keep people safe.
Operator, next question.
Thank you. La prochaine question, our next question, Émilie Bergeron, Agence QMI. Your line is open. À vous la parole.
Hi, I just have a question about eligibility for extended family members. It's written in the press release that people need to be in a exclusive relationship for at least 1 year. So how are people going to prove that if they don't have the same address?
Well, as I said, among the measures that we're going to put in place to assure ourselves that there is an established relationship for a period of a year, we are requiring a notarized declaration from the parties to make sure that we can say with confidence that it is a genuine relationship, it's a relationship that has existed for at least a year, and that it is a relationship where the two individuals have spent some time in the physical presence of each other during that period. There will be more details that will be laid out between now and when this particular category and process is introduced on October the 8th. And there will be a website. And as I said, my department will be there to provide the additional support to walk people who wish to avail themselves of this pathway in very short order.
Emilie, follow-up?
The Prime Minister said this morning that there was very low levels of propagation of the virus from people entering Canada. So I just wonder if you have like some numbers to give us or to update about how many eclosions happened because of family reunifications or cases like this.
Minister Blair?
Yeah, we can make available to you the more precise data. We measure this very carefully, but for all of the transmissions and illnesses in Canada, through our efforts of contact tracing, what we have found is approximately 2%, between 2 and 3% of those transmissions, they have a relation to a travel component. And then a small fraction of those, less than 2%, are actually related to international travel. But a couple of things I also think it's really important to keep clear. That the success that we have been able to achieve in reducing transmission related to international travel is a direct result of the very rigorous processes and restrictions that we have put in place. And our people, I think, have done an extraordinary job. And frankly, again, I want to express my gratitude to the members of the public service, both in health and at our border services, who've done a really great job of making sure that we protect Canadians and enforce these measures. I also think it's important to point out that, it's a difficult determination for the border service officer. If someone comes and wants to make a case for compassionate entry, for example, and it may be, and perhaps people wouldn't have the documents, the attestations, the medical reports that are necessary to support that application. And that's why I think it's also very important that we push that decision a little out from the border, that we create a process whereby people can provide that information and that there can be an appropriate determination. That'll help the border services officers do their job in acknowledging and recognizing that compassionate case. And it also enables us to rely on the expertise and the knowledge of our health officials and the Public Health Agency of Canada to help us in making that determination. It's very much a partnership between us. We are trying to make sure that we do the right thing for Canadians and for Canadian families, and at the same time, we are going to remain vigilant, and we're strengthening our controls at the border, because protecting the health and safety of all Canadians has to be and remains our first priority.
We'll now go to the room.
Peut-être je peux. Could I just add a word there?
Yes, absolutely.
I'll just add, Emily, ça c'est la raison pour le quarantaine de 14 jours, parce que c'est la première fois premier mode que nous pouvons détecter le virus. And it's very important that we understand that 14-day quarantine means that those importation, the 2% or 3% of cases, actually can be stopped in those 14 days of quarantine. This means that, yes, some people will get sick when they come to Canada. It is a sneaky virus. People are asymptomatic when they board planes, and they may be asymptomatic when they débarquer when they get off the plane. But the 14-day quarantine is actually the protective measure there, because when people become sick, they're in quarantine, and that means that we're able to stop the transmission into the wider population. And that's why on the compassionate relief for example, end-of-life cases, we're working so closely with local public health and provincial public health, because they are in the best place to determine how, if someone is allowed to leave quarantine early, we still protect Canadians while meeting the goal of allowing them to be with their loved one at the end of their life, for example. Thank you.
Thank you. We'll now take questions from the room.
Glenn McGregor, CTV News. Minister Mendocino, you mentioned the case of Sarah Campbell, certainly a compelling case involving a cancer diagnosis. There's another person in Whistler, British Columbia, a case you may be aware of, named Sherry Santiago, who is in the last stages of her life, also receiving palliative care for cancer. She desperately wants to see her sister one last time. Her sister was denied a visa, a special exemption to come visit her from Philippines. I'm wondering, in the spirit of this announcement, would you make a special case for her? She may not have until October 8th. I'm wondering if you would make a special exemption to your further exemption here, ensure that she can get to visit her sister in the next few days from the Philippines.
Well, let me just begin by saying that I acknowledge that this has been a really difficult time, not only for Ms. Santiago, but for a lot of families, Glenn. And as I mentioned earlier today in the House, it's one of the main inspirations, the source of our motivation to try and put into place a process as quickly as possible. But because of where we are at in the current pandemic cycle, we had to take the time and the diligence to make sure that we put in place the measures that are necessary to protect the health and safety of Canadians. My heart goes out to everybody who is separated right now, not only to the family that you've mentioned, and it's our commitment to try and get these processes in place as quickly as possible so that we can reunite as many families as possible, reunite as many compassionate people who want to come for compassionate reasons as quickly as possible, but at the same time protecting the health and safety of Canadians.
A follow-up for Minister Hajdu. Minister, we're seeing long lines in a lot of places across the country, people lining up for testing, waiting hours, missing work, kids missing school for days, and then further waits to get results back. And at the same time, some people are going to private clinics and paying to get their tests, sometimes paid by their employer, including members of Parliament who can have their employer, the House of Commons, pay for them to get tested in Gatineau, paid for by taxpayers. Wondering if you think that's fair to average Canadians who can't afford to go that route, and whether or not it's consistent with the Canada Health Act that you, as Minister of Health, are responsible for upholding.
Well, thank you very much, Glenn, and it's a really important question. And I think on part one of your question, look, that's why we contributed nearly $4 billion to provinces and territories in May over the summer, so that people, provinces and territories would have the money they needed to build up their capacity and to refine their testing strategies to make sure they were testing the right people at the right time at the right place. And I'm pleased to see provinces and territories start to adjust those strategies so that we really are getting at who needs to be tested and when. And, you know, obviously that will continue as we onboard new tools, as the testing guidance is updated nationally and certainly at the provincial level. And I know all provinces and territories are working really hard to get that mix right. In terms of, you know, employers that have their own processes, including the House of Commons, I can tell you that there are employers that have, you know, employees that face high risk situations that are actively screening their employees. For example, long-term care homes where people are working with vulnerable people. There may be additional tests available to workers in certain long-term care home facilities across provinces and territories, depending on jurisdictions. People have a blend of benefits and rules and regulations across the country, and employers, of course, always have the prerogative to address their own health and safety and occupational health and safety in ways that make sense to them. In terms of the House of Commons testing site, listen, you know, as we can see from high-profile cases of people getting COVID-19, including Canadian politicians, there is a very, I think, valid public health reason to make sure that people who travel a lot, who interact with people a lot, and who also go back and forth from home to work have an ability to be able to test if they are exhibiting symptoms. And I will say that's an important element of the House of Commons testing site for parliamentarians. It's really about making sure that if they are symptomatic, that they are able to understand whether or not they're COVID positive before they go on to infect other people they may come into contact with, including other parliamentarians, but also constituents in their riding and other people that they may meet when they're traveling. This is, obviously, I think, an area that's being refined worldwide as we move forward on testing across the country and across the world. There's an enormous pressure on countries all around the world to have access to enough testing, but also to new tools that can help with screening. And I must say, I'm excited about the onboarding of increasing tools that will help us screen for coronavirus so that we can actually use testing for what it is, which is a diagnostic tool. So I'll leave it there. Thank you.
Hello, this is Steve Shear from Reuters. I have a question for Minister Blair. As you know, the border closures are only supposed to well, they're supposed to end later this month, but what we're hearing today are tweaks to measures around those border restrictions, which suggest that they might be here for a lot longer. Can you say how long you think the border restrictions will be in place, and how likely or how realistic is it that we're going to see the border restrictions lifted by the end of the year?
Well, thank you for it. I think it's an important question, and a question a lot of Canadians are concerned with. And first of all, I want to reassure Canadians that we engage in the work every single day in evaluating the conditions that exist on both sides of the border and in international destinations, and in order to carefully monitor whether or not the circumstances are still consistent with our decision. We know that the decision, by the way, to close borders been hugely impactful. It's impactful on Canadians and border communities. It's impacted on people's jobs and the quality of their life. And so it's not a decision that we come to lightly or renew lightly. But at the same time, we are very mindful of our responsibility to keep people safe. And so we constantly evaluate those conditions. I can tell Canadians that the decision to renew those border restrictions and closures is one that is made thoughtfully and based on the best evidence that it's available to us at the time. We will continue to monitor the situation very carefully, but I also want to reassure Canadians, until the conditions on both sides of the border, or as it pertains to international travel, change very substantively, until we can be assured, based on the advice that we receive from our public health officials and our evaluation of those conditions is such that we believe that those restrictions can be lifted safely, we'll keep them in place. And I know it can be challenging, and I'm not at all insensitive to the enormous impact that this is having on a lot of people and a lot of families. But we have to take these measures to keep people safe. Our restrictions at the border as well. It's not just that we've closed the gate. We've put in strong measures of enforcement and tracking and tracing, and the quarantine measures, as Minister Hajdu mentioned, have been such an important part of the effectiveness of the measures that we have taken with respect to non-essential travel from international destinations and the United States. We'll keep those strong measures in place, and we'll continue to build upon them to protect the health and safety of Canadians. And when we are confident that there are some circumstances that we can accommodate, as we have today, on issues of compassion and family reunification, for example, then if we believe that we can safely manage that, and that we can put in place a procedure that will always protect Canadians but allow for those exceptions which are exceptional and require our compassion and our care, we'll do it cautiously and we'll do it carefully. And Canadians can be reassured that the decision with respect to our border is being made by the Government of Canada in the interest of all Canadians. And we will remain vigilant in the protection of our citizens.
Thank you, Minister. I have a follow-up for Minister Haidu. You mentioned earlier the 14-day quarantine and the reasoning behind it. Airlines have been pushing for quite some time for COVID testing to maybe rapid COVID testing, but essentially COVID testing to replace the quarantine. Now, in the middle of the second wave, I don't know how likely that is, but are you at all considering going forward replacing the 14-day quarantine with COVID testing, a negative COVID test?
Well, thank you for the question. And again, another area where all countries are struggling to figure out how to do this safely. In fact, we have a number of interesting research projects that are being proposed and that are some that are close to finalization. One that's happening right now with Air Canada and McMaster University to look at exactly that question. Could we have a blend of a quarantine and a test on a specific date that could give us certainty that it would be just as effective to have a shorter quarantine with a test at a specific time in terms of containing those importations? So yes, that is a space that we're actively investigating and supporting in terms of research, and we'll have more to say as those research projects unfold and start to deliver some results.
Thank you. Operator, we'll go to 3 more questions over the phone.
Thank you. Merci. Once again, please press star 1 on your telephone keypad if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. Our next question, Marie Vestel, Le Devoir. Your line is open. À vous la parole.
Oui, bonjour. I think my question is for Minister Mendicino. I just want a clarification. In the case of Quebec, I think that you need a certificat de sélection du Québec for certain family reunifications. Can you just clarify in what you've announced today for extended families? Does that apply? Is there anything that needs to go through Quebec? Can you just clarify if there's an added step or a delay in those cases for Quebec?
Merci pour la question. Nous savons qu'il y a une entente entre Canada et Québec où nous partageons les responsabilités sur l'immigration. Le Québec avait les compétences pour faire les décisions pour les immigrants économiques. Et pour les classes familiales, c'est un area que nous partageons. Donc, on va continuer de communiquer avec le gouvernement de Québec. Comme j'avais dit à le commencement de mes paroles, nous avons consulté avec tous les gouvernements provinciaux et on va coordonner avec le gouvernement de Québec pour ce processus qui était introduit aujourd'hui.
Follow-up?
Oui, juste préciser, c'est pas vraiment clair. Donc, est-ce qu'il y a un délai supplémentaire au Québec ou vous êtes déjà entendu pour pas que ça s'applique? And I just have 2 small clarifications on the compassion exemption. What's the date? Is it October 8th as well? And you mentioned people need to live together for a certain amount of time. Do we know how much time?
Non. J'espère que ça va prendre le même temps. Et comme j'avais dit dans mes paroles à la commencement de la présentation aujourd'hui, les exemptions familiales commençaient à la 8 octobre. Donc, ça, c'est
asking for compassion for Minister Haidu. What's the date?
Et c'est la même chose pour les cas des compassions, pour les raisons de compassion. But I'll turn it over to Minister Haidu. Sorry, Minister Haidu, if you wanted to follow up on compassionate cases.
Thank you, Marie. And on compassionate cases, our approach is in those particular cases to work with the province, province, in this case, Quebec, but also the local public health units, regional public health authorities, to make sure that everybody's comfortable with the exemption from the 14-day quarantine. And this will be no different in Quebec. It's really important that we work in partnership for these particular cases because of the risk of, as we just spoke about, the quarantine being such an effective tool to prevent importation into communities. But it can be done safely when everybody is very, very diligent. And we have seen that in a number of compassionate cases that we've been able to manage in this way, where in fact the hospital that the person is, unfortunately in has full awareness and a plan, where the local public health authority has a plan, and where the provincial government has given authority.
Operator, next question, please.
Thank you. Our next question, la prochaine question, Stéphanie Levitz, Canadian Press. Voting est ouverte. Please go ahead.
Hi, my first question is for Minister Mendicino, and it's also a matter of clarification on this October 8th date, because is it that people will be allowed in beginning on October 8th, or the application process will open on October 8th, and then what is the guaranteed turnaround time you're providing to people?
Thanks for the question, Stephanie. So people will be allowed to enter under the broadened family class as well as compassionate cases as of October 8, 2020, and it is our intention to launch the process for applying for eligibility under both of those classes before then.
Follow-up?
Okay, thank you. Yeah, my follow-up is for Minister Hajdu. And Minister Hajdu, I'm curious about, Canadians are getting very anxious about the growing number of COVID-19 cases, but compared to the spring, the number of people actually dying is falling sharply so far, anyway, which is good. How does that change your thinking about the way governments need to respond to the pandemic going forward?
Well, thanks for the question. And first of all, I'll just say that deaths are a lagging indicator. We know that actually it can take a while to die from COVID-19. And so as much as we see, lower deaths than the initial surge in the spring, we're watching very carefully hospitalization rates and deaths. And in fact, hospitalization rates are going up, which is not a good indicator. In terms of how we plan to deal with this differently this time, I think we've had an opportunity to learn a lot from the first surge of the virus in the spring and all of the work that we've done collectively as provinces and territories over the last several months. And I think that allows us to have a much more surgical or regional approach to managing COVID-19. We have more refined tools. We have a better supply of personal protective equipment. We have new therapeutics, for example. We no longer are relying solely on ventilators worldwide. We've discovered that there are, for example, anti-inflammatory drugs that can help with severe cases of COVID. And certainly we know a lot about how to prevent COVID-19, and we know more about what kinds of circumstances lead to increased spread. So I think we're in a better position this time to manage illness. But listen, at the end of the day, we still can't see these rises in number, these rises in cases increase exponentially. We have to work really hard to protect our public health care system. If in fact we see hospitalizations that exceed capacity, that makes it very untenable for politicians to continue to balance the economy and the health system. And ultimately, at the end of the day, this is a fine-tuned balance between making sure we can continue to have some semblance of a normal economy, normal life, and also protect our healthcare system and the health of Canadians. And so we are continuously working on that as a team, as I would say, a nationwide team with all provinces, territories, and local public health units.
Operator, last question over the phone.
Thank you. Our last question, Cormac McSweeney from City News. Voting est ouverte. Please go ahead. Unfortunately, we do not hear you. If you are on a speakerphone, please pick up your headset or unmute your line. Yes, please go ahead.
You can hear me now? Okay, sorry about that. I had mute on. I've been in and out of this news conference, unfortunately, due to filing reasons. I think you addressed this earlier, but I do want to just ask it straightforward. Why would you announce this now when people have been calling for these sorts of measures since late spring, and we saw a lull in cases over the summer, or at least a dip in cases, and we're getting this announcement now when we're seeing COVID-19 cases spike? We're seeing even public health officials express fears that their health systems could now be overwhelmed with what we're seeing in the second wave.
Well, as you heard both my colleagues, Ministers Hajdu and Blair, say, we have put into place today strengthened measures and resources that will positively impact the health and safety of all Canadians at our borders. We took the time that was necessary to put those measures into place, as well as the policies to create the pathways which would allow additional families to be reunited, as well as people who are wanting to come to Canada for compassionate cases. We also took the time that was necessary to consult with our provincial partners to ensure that they were on board as well. And so by doing all of these things and by being diligent about them, we have both shown a capacity to be compassionate to those people who have been kept apart as a result of the pandemic, while at the same time ensuring that we protect the health and safety of all Canadians. And as you've heard now, that is our paramount objective. And I'm happy to turn it over to Ministers Hajdu and Blair if they have anything to add.
I'll just add, Cormac, in addition to what Marco has laid out in terms of the progression of working so closely with provinces and territories, making sure we get this right, I'll also say it's clear from the worldwide growth of COVID-19 globally that this disease is not going away anytime soon, and that countries will be struggling for a very long time. And this government believes firmly in compassion, and we know that we needed to take these steps, given that this is not a short-term problem defeating COVID-19 globally. And so these processes have been thoughtfully planned with provinces, territories, and local public health so that we can respond to people who, as Minister Blair said, need their loved ones, sometimes in the darkest times of their family lives. And so I am thrilled to be able to move forward in this way that's safe for Canadians and that shows compassion to people that are separated by the border in times of great need.
Follow-up?
Yeah, the follow-up is unrelated to this announcement, but it is for Minister Hajdu. Minister Hajdu, earlier today, Health Canada announced that it has received its first submission or application for the authorization of a vaccine candidate, and that's with AstraZeneca. And I'm just wondering, what is your reaction to the news that we have this first application in now to Health Canada so they can start this rolling review of a vaccine candidate? And can you give us an idea of how long the process from this point on will take before we get a decision about whether Health Canada approves this vaccine or not?
Well, thanks very much. It's a great question. And you're right, it's a new process that typically we haven't had with vaccines. In fact, my understanding of vaccine development is that sometimes it's a decade long, including up to a year or longer in regulatory approvals. But the changes that we made in anticipation of vaccines being developed and submitted to Health Canada allow for a rolling review of evidence as it is developed by the pharmaceutical company, in this case, AstraZeneca. How long? It's hard to say because of course, it depends on the clinical evidence that AstraZeneca provides, and that is dependent on their own process that we can't control. But I can tell you that we are delighted that they've submitted to Canada at the same time as the UK. And we're very excited about the process of reviewing with AstraZeneca each step and each finding that they have. And finally, I'll just say, this is exciting news for the world that we have a vaccine that is this close to deployment. Now, I will also say, that vaccine development, there's a lot of bumps in the road, as we've seen. And so we'll be speaking more and more with Canadians about what we can expect in terms of deploying the vaccines as they become available. I also want to give a shout out to Minister Anand and her team who've been aggressively procuring contracts with vaccine manufacturers. In fact, Canada has 6 now, including AstraZeneca, which gives us the diversity to know that we have a suite of vaccines. We have our bets, if you will, on a number of different promising vaccines. And I'll also thank the Vaccine Task Force, which, as you know, is comprised of experts and advisors who work in and around the pharmaceutical industry, who are giving us extremely good advice about how to proceed as a government in terms of procuring these vaccines and later deployment.
That's all the time we have for today. Thank you all for joining us.